exposure. Came to the gym, y'all. Jennifer Dupo, hair loss and scalp disorder specialist. I'm sure Pat, she introduced herself. Welcome, welcome to our Friday conversations, H2GROW Inc. We are both owners of H2GROW. And happy Memorial Day weekend. How's everybody doing?
Good. How are you, Jen? I see you color your hair.
Yes, I have to change it up for the summer because the whole advertisement is more color. So those out there that's looking for some color, Just Relax Salon. I did my own hair. It took me about 3 hours, y'all, but that's what happens when you're taking your hair from one level to another level. But yeah, I like it. It's something different. Just wanted to
Yeah, it looks nice.
Thank you.
Yeah.
Yes. So how's everybody doing out there? Hope everybody doing well. How you doing, PaTricia? How you doing?
Good. Actually, been busy, but I'm good. No complaints here. I can't be complaining, but for what? Who's gonna listen?
Listen.
They got their own issues and their own problems. So I just stay calm and just give it to God and
Yes.
continue on with my day, So
Absolutely.
Yeah.
So today we want to talk about hair loss and clients that are dealing with chronic issues. What does that mean? Because some people don't even realize they have a chronic issue, right?
Yeah.
So we got clients that suffer from different ailments like diabetes, high blood pressure, autoimmune,
Yes.
skin autoimmune, so like lupus discoid,
Yes.
CCA. Those are just to name a few. I'm not going to go, it's a whole lot of different things, but normally PaTricia and I, we see those cases more often. Also, trauma, having surgery, going on, having anesthesia. Anesthesia is a form of trauma, which also
Yes.
your hair, meaning you're going to have shedding. Sometimes you'll have unnoticed shedding because we're not paying attention. But then 6 to 8 months after your surgery, you're going to start seeing some things and you're like, I don't understand what's going on with my hair. It looks a little thinner. Yeah. So these, that's not chronic, but if the situation that caused the surgery to be chronic, like thyroid, having your thyroid removed or partial thyroid surgery, thyroid also affects our hair. It makes extreme hair loss, and sometimes we get patches and things like that. So our conversation today is chronic hair loss issues and having a strong product to support the foundation of when you're going through these things. If you're taking a product like H2GROW and you're using it on a regular basis, it's going to offset the extreme hair loss that you'll have if you didn't do nothing. Also, clients that have weight loss surgery, things of those natures that also causes hair loss. If you're taking H2GROW system specifically, because I can only speak on experience.
Yeah.
I have clients that are going through different things, and I see different things. And so, as they've been on our H2GROW products for 2 and 3 years, I've seen that they were able to still keep their hair in a healthy state, even going through spurts of hair loss. So we just want to talk about that.
Yeah, so you recently had a client who had weight loss surgery.
I also had a client that had partial thyroid surgery.
And she maintained the products, and she was on the products, and she maintained her hair.
On the products because she had to go through an evaluation for 1 year. And as she consulted her stylist, because that's what you should do, she informed me of her journey of preparation to surgery. And I explained to her when she goes through that transition, she will experience extreme hair loss if she does not anchor herself with a strong foundational product. So she listened because that lady loved her hair, y'all. And she's got a lot of hair. So you have clients that are very, very adamant about their hair, and she was that person. So she's always been on the nutrients. I'm not going to say she's done the laser treatments and things like that. Just our nutrients help to support the sustainability of her not losing hair, Now she's probably 5 months in to her surgery, and we're still balanced out. So our
Yeah.
nutrients are, we have our 30-day shellfish free. What does that mean? Marine biocomplex. So I'm allergic to shellfish. I'm allergic to iodine. So that's the formula that I take for myself as a supporting part of my nutrition, along with other supplements that PaTricia and I are probably
Mhm.
similar to take. And we also have our 90-day complete ideal, which is a 30-day formulation that has all of the natural supplements that are going to help support and sustain the growth of your hair. It's actually reasonable. It follows, let's see, what does it, it's comparable to Nutrafol and those particular
Yeah.
nutrients that are on the platform for hair loss. So we always push that because deficiencies in our bodies tends to be the main trigger of making our hair fall out. So it's good to make sure you're taking things that's going to keep you stable. So that's just me giving you guys a little bit of product knowledge because it's very important. You guys want to know
Yeah.
what is it natural? Is it going to affect other medicines? No, because I have clients that have diabetes. I have
Yeah.
clients with thyroid medicine. I have clients that are high cholesterol and they're taking our nutrients. So
Yeah.
those are just three things that I know, and they are actually in the nutraceutical category, which means it's a nutrient. But you always want to
Check
verify with your doctor
with the
and make sure
doctor.
you're not taking other supplements that's comparable that's in that nutrient because you may not need those nutrients and you're just going to take our nutrients. So always follow up with the doctor. We do not diagnose, we recommend. We are not doctors, but we are certified to see things that are happening when it comes to hair loss. So,
Yeah.
did you want to add anything to? I know I said a lot, y'all, but
It's okay.
I just
Well, just
informed.
like just like Jennifer has a client who went through weight loss surgery. I had a client who did weight loss surgery some years ago, and she is on the system, and
Yes,
she takes our nutrients as well. She does it to maintain her hair, her beautiful hair,
right,
because she still doesn't eat the amount of protein that a body needs to absorb. And because they don't eat enough or they don't eat enough
right,
protein, you know, not having that protein in your body, you can lose your hair as well.
exactly.
So she maintains her
Okay,
nutrients. I have her on a collagen, a probiotic, and a
omega threes.
omega
Yes,
3. Thank you. So those are some things I recommend, and I recommend it from Herbalife because I
it
know from
works.
experience that it works. Now I'm not saying that other collagens and probiotics don't work, but I recommend that to my clients.
Exactly.
So yeah,
Awesome, awesome. So
yeah. So
go ahead.
we're here to help those who are going through weight loss surgery. You have those who are taking Ozempics and all of those things, which is good to lose weight, but you're losing the weight so fast that you don't get enough proteins and nutrients and in your body. So you need supplements to help you while you're going through your weight
Journey.
loss journey. Okay.
So
So
if it's up to Dr. Max, he's going to tell you do it the natural way.
yeah,
However, everybody has their form and
yeah,
choice. So be mindful when you're taking these different um, journeys to lose the weight. Look at the side effects. What will it cause when I do this particular process? And then make a conscious decision that if you're okay with the side effects that it may cause,
yeah,
then go right ahead. But if you're not, then find other solutions that might be a little
yes,
more natural and allow yourself to take a more healthier approach. I'm
yeah.
always about healthier.
Yeah, and it's slower. Yes, taking the natural route is slower because I am on a detox.
Right.
How many I can't count how many days in, but I see my face is slimming up.
Yeah.
I've been walking.
Yes.
Um, I've been drinking a lot of water. So yes, it's a little slower than other things, but I decided to take a more natural approach. I'm eating right. I cut anything that is white. I'm not eating it, like sugars and bread and pasta. Well, I did have a little bit of pasta with Fitz this week,
Right.
but but I did eat from a small bowl. I didn't like
Portion.
get a big bowl and be like, oh my gosh. So it's portion control.
Right.
And with me, I don't eat on time. So it's not like I eat a whole lot. I don't eat enough. And then when I'm ready to eat, it's late, So I'm learning how to control it, eat my breakfast, lunch, and dinner with my snacks in between.
Right.
So yeah,
That's awesome.
taking care of me.
Absolutely. I also was having a discussion with clients that have the fufa, the stomach area, right? So when we talk about our gut, it's a lot dealing with your gut health, but also it's diet.
Yeah.
Reducing the fat around your waistline is what you eat,
Mm-hmm.
and and adding exercise, because you can just exercising alone is not going to be
No.
the solution.
Mm-hmm.
For me, I've been having like bloating issues and feeling real like irritable. So what I've known from my lifestyle, before I work out, I don't eat. I take like a pre-workout with Herbalife,
Mm-hmm.
and then I drink water in conjunction with coconut water about 12:30. Then I'm eating at 1.
Okay.
So that's me, because
Yeah.
it for me. So I say do what works for you, but I realize that reducing the things that you just said, and
Mm-hmm.
portion control, picking the right foods that are not going to create the bloating, and reducing, allowing my stomach to rest, because a lot of times we think we need to eat. No,
Yeah.
you eat to live, not live to eat.
Mm-hmm.
Okay, I'm a foodie, but we still have to eat to live, not live to eat. So I just wanted to share that. So yeah, any
And
other?
also we are still in what is it, mental health
Yeah,
month, with mental awareness.
right.
So keeping your stress level down, maintain a healthy maybe regimen. Like Jen and we do a little exercise. Jen do more exercise than I do. I walk. Jen is in the gym with her trainer, killing it. With and then there are little things like gardening. Like I am out there gardening, and you could have a hobby. You could do Pilates and yoga.
You know what?
You can see Dr. Max. Dr. Max can help you with stress levels as well with
Yeah.
acupuncture. So tell them a little bit about that, Jen.
So acupuncture is not just for. Well, let me backtrack. Acupuncture can help many things. And
Yes.
I partnered up with my brother, Dr. Max, because in conjunction with PaTricia and I helping men and women restore their hair, it helps with hair loss. So Dr. Max, in the clinic, in the salon, he does ear acupuncture. What does that mean? The ear is the map of the body. And so when you come in, he does a consultation based on reading your pulse and looking at your tongue. Why? Because those things will give him a clear view of what's going on with your organs.
Mm-hmm.
They go of the problem based upon the organs in the body. And so when he's making his analysis on what's going on, he'll then say, okay, this is a little weak, or I see this or that, and then he will give you a ear treatment, which is about 20 minutes. And then he will also recommend herbal formulas, because PaTricia and I, and also some other people that I know that has come to him, take herbal formulations. Again, based on what you're dealing with your doctor and him. Dr. Max also will say, let's see what you're on based on with your doctor, and then he will then formulate. So acupuncture is very good for hair loss. It helps
Yeah.
with hair loss. It helps with other ailments. He's also treats in his facility for a full treatment, but
Yeah.
just 20 minutes of ear acupuncture is just as effective than him just doing a full 1 hour treatment. So I
Mm-hmm.
challenge you guys to come in and try it out, because it's been helping me, and it's definitely been helping
Yeah.
PaTricia, because she had many little ailments that are going
Yeah.
on, even pain
Mm-hmm.
and pain. He's helped many women with
Yeah.
female reproductive issues,
The shoes. Mm-hmm.
male intimacy issues,
Yeah.
things he can help. So I just wanted to put that out there. PaTricia and I, we're going to do more informative, um, informational videos so that you guys can truly understand how our products work.
Yeah.
Because it's not just the whole system. We could create solutional problems by pointing out certain things, but the system is the best way, because you want to do, if you want a 100% result of the product working, you should use the whole system. However, we'll
Mm-hmm.
where you are and still give you things that are going to maintain your hair so that it's not so you're not having major hair loss issues.
Yeah.
So acupuncture is great. So you guys take advantage. We are going to be running a special. We're going to do
Yes. For
15% off.
Memorial Weekend,
15% off. Dr. Max is only in the
50%
office
off.
on Wednesdays. So you have to make an appointment. You have to put a deposit, and you come in. It's like a 20 minute visit. So you can come on your lunch break. Come on your lunch break, get your treat, and go about your day. So if you guys have any questions or concerns, you can DM Dr. Max in Bronze Man Acupuncture, or you can go in his bio and give him a call, and then he will kind of walk you through what the process will be, and you go from there. But I really, really recommend acupuncture, because it's all about, for me, the healthier way. I rather allow my body to go through a healthier process than taking pharmaceuticals that might destroy something else. Now I got to go fix something else based on the pharmaceuticals that I had to take. But
Yeah.
I don't not believe in conventional medicine. I do. We need it, right? Some stuff you're going to need conventional medicine, but try your best to have a balance.
Yeah.
That's what I say. Everything is a balance.
Yeah.
Not pro this or pro that. We feel like if you need things, you need to balance it out. One more conversation that I wanted to talk about is you have to know what the problem is, and you got to go to a doctor. You got to get blood work, and you got to get a diagnosis, right?
Yeah.
You need to know what your root problem is. And PaTricia and I, or any certified trichologist that I know, we could recommend some to you. We can help stabilize what's going on while you get answers about the root problem. That is my concern about a lot of us. We're assuming we have something going on, or we don't even know what's going on, because you didn't even go to the doctor to get blood work. You got to go to the doctor to get blood work for
Yes.
specific treatments. And if you don't know what's going on, come to us so we can kind of do an evaluation and say, ask your doctor to run these particular tests, and then let's rule out what we
Yeah.
think we see. If you're only going to say, I see something doesn't look right, so I recommend you to go to the doctor so we can get a diagnosis. And once we figure that out, now we can balance based on the things that you're taking with your doctor, alongside H2GROW Inc. products that were formulated to strengthen and help to regrow hair.
Yeah.
So,
And also, as far as mental health, a lot of times people will burn a candle. So
yes.
now H2Grow have candles. Actually, Jen, while you're traveling, we have a couple of, we have some pre-sale orders.
Oh,
So I'm gonna make the candles this weekend.
awesome.
I know that you're traveling, so I'll just take care of those orders. And they have been placing orders for candles, so they smell beautiful.
Love
This
it.
is not what it looks like. This is our sample. While we was trying to come up with a scent for calmness.
Stress
But I
relief.
burn this one, and my clients always say, "What's that smell? That smells so nice," and it just relaxes them.
Yes.
So burning a candle can relax you as well. So you can purchase your pre-sale candle on our website,
Right.
www.h2growinc.com, and we will get it to you as soon as we can. Because you can make it, but it still have to sit and wait, a week, and then we can mail it out to you. So, yeah. So we do have some orders, and I was like, wow, look at this. It's a pre-sale.
Yay.
People are placing orders for their candles.
Thank you,
And
guys.
then while they're on there for the candles, they see all other products that we have to offer, like our finishing products, our anti-itch growth oil, that just flies off the shelf.
And then we will also talk about, we're going to have a conversation about protective styles and prepping yourself for the summertime. So we
Yes.
have great products to support that. That's another
Yeah.
day.
We'll be on live all day if we just talk about everything.
We do have finished products to support hydration,
Yes.
smooth those edges. We have our edge control. We have our anti-itch growth oil. We also have our scalp cleanse therapy. We have a lot of clients that may have dry seborrheic
Mhm.
dermatitis or seborrheic dermatitis. So we have solutions for all of those things.
Yes.
Feel free to sign up for our newsletter so that you can know when we're running specials, so you can get information about hair loss and hair concerns, H2GROW products. So H2GROWinc.com, sign up for our newsletter, and you could participate in receiving discounts and educational informationals to support your journey.
Don't forget to follow us, of course, on IG, TikTok, Facebook, and our YouTube channel, H2Grow Inc. Hair Care Products. Follow, subscribe, and like our videos, guys. We need your support. Thank you in
Thank
advance.
you. This is great. I'm glad we had this was a good conversation. We definitely want to share as much information as we can with you. But if you need something more in detail, schedule your discovery call, or you can book an appointment with myself or PaTricia for a hair loss consultation, or you can get a hair and scalp analysis in person. So again, you could also do that on H2GrowInc.com or Hair to Touch or Just Relax Salon. So thank you again. Thank you again for all of the support that you guys have given us.
So for those who are visiting here in sunny South Florida, Miami, be safe out there.
Absolutely.
Enjoy the beaches and the weather, because it is
It
hot
is
in
extreme.
sunny
Yes,
Miami.
exactly. Great. Wish you a great day and have a prosperous day. All right.
Have a So be patient, guys, and
Assistant. Wonderful
bye.
Memorial Day.
And Jen, have a safe trip.
Thank you.
Enjoy yourself.
So
Take
excited.
plenty pictures.
Absolutely. I will take lots of pictures. All right, y'all. Y'all have a wonderful day.
Bye.
Bye-bye.
Everyone, a happy Friday. Remember to follow us on YouTube, TikTok, Facebook, Instagram. You could purchase our products on, like Jen said, on Walmart Marketplace, TikTok Marketplace, Facebook Marketplace, and soon Amazon. So I want to say, be patient, stay consistent, and guys, yes, we're living in stressful times, but guess what? God is always providing. So Stay blessed and continue to move forward. Have a blessed day. Thank you. Bye.